the gentleman from Ohio.
Well, thank you, Mr. Chairman.
Mr. Latta is recognized for 5 minutes.
Multiple things here this morning.
Hold the clock for just a second. Let him at least get turned into his pay. I just did the same thing upstairs. I apologize to our witnesses, but we have multiple hearings going on, and we're trying to let every member who is interested in the subject matter ask their questions. And I just ran upstairs to the Environment Subcommittee and asked my questions and ran back down here. And I appreciate my vice chair filling in and helping me out. We both did that at some point today, but I appreciate our witnesses. And now I believe the gentleman is ready.
Well, thank you, Mr. Chairman, and appreciate your indulgence. And to our witnesses, thank you very much for being here today. This is a really important hearing, critical to public health, workforce, rural health, and over-the-counter medicines. The over-the-counter monograph drug user fee program, AMUFA, at the Food and Drug Administration gives consumers access to manage their own care in a safe and affordable manner. 5 years ago, I worked with my Energy and Commerce colleagues to modernize how the FDA regulates the most OTC medicines with the enactment of the AMUFA program. These revolutionary changes made the 40-year-old system more efficient, transparent, and open to innovation. I'm very proud to once again be leading this reauthorization of such a critical program. The AMUFA program has drastically reduced the burden on our healthcare system by lowering the number of visits consumers need to make to a doctor to obtain a prescription for a simple treatment. Again, 5 years ago, when Congress initially passed my legislation to reform OTC monographs, I entered into the record a statement of intent on data required for general recognition of safety and effectiveness for non-prescription drugs. The statement reads, general recognition of safety shall ordinarily be based upon published studies which may be corroborated by unpublished studies and other data. Unfortunately, in the 5 years, I'm concerned that the FDA has not fully acted in accordance with the congressional intent by requiring superfluous information. I'm concerned that these delays the innovation prevents consumers from benefiting from new and improved products. If I could ask my first question to Dr. Corrigan-Curay, hope I pronounced that properly. In the last 5 years, how has FDA worked to improve the process for expediting the review and administrative order process for monographs?
Thank you. In this first 5 years, what we've done is we've changed this from a paper-based rulemaking to an electronic communication system. We've given fundamental guidances so the expectations are very clear. We've started meeting with companies on their programs. We're meeting all those goals. We have the first OMAR for a sunscreen. We've issued 33 final orders, and we have 5 proposed orders to update some of the safety labeling, as well as a new order that we're going to, proposed order that would allow innovation in terms of dosage form. So you could go from tablet or capsule to an oral disintegrating or a chewable, and so that would allow, children and those who have trouble swallowing. So we've done a lot. There's more to do. And in MUFA 2, we want to provide more opportunities for interactions with the FDA and companies so they know our expectations, looking at their protocol synopsis. We'll work on issues in quality. We'll work on transparency in exclusivity, transparency in fees and who's paying the fees and who's not paying the fees. So we think we're on a good path to continue this innovation.
Just follow up on that. What's your timeline? Because you said there's more things to do and more to get these things through the process. Is there any kind of a timeline that you're anticipating?
Well, right now we are working with companies and we're working on the proposed orders. We need to get the comments, finish the comments, and put them through. The sunscreen that is in, so this would be for a new sunscreen ingredient. We're working along with our timelines that we have in our commitment letter. The new things under AMUFA 2 would be really to sort of continue to grow the program in a way that fosters innovation by working, providing other opportunities to interact with FDA and understand our expectations, provide more clarity and education on the GRACE standard, which I think is what you were saying. There may be some confusion about what our expectations are. We certainly don't want superfluous studies. We want studies that answer the question, and that's all that we need.
Thank you. And I'm interested, I believe this subcommittee would benefit from reviewing the study that was required in my previous OTC modernization legislation. So, again, it's just, you brought up one of the issues out there. I know we've heard in this subcommittee for a good number of years, it's just like on sunscreen. And I'm sure it came up, some other members have already brought it up, but, the Europeans, they always say are so much far ahead of us on this. And so we want the United States to lead. So I look forward to working with you, and I appreciate the chairman and for the work that is going to be done in this subcommittee. And I also just want to take a point of personal privilege and congratulate you on the gavel here in the Health Subcommittee. I yield back.